Cannabis cuts blood supply to tumors. Hey guys, I'm Dr. Thomas Henke, medical doctor and expert cannabis physician. I'm here to help medical cannabis patients, coaches, and doctors by reviewing the research studies and clinical applications of medical cannabis. Today we'll review the effects of cannabis on tumor cells and discuss one of the most important anti-tumoral strategies explored in recent years. Specifically, we're looking at the evidence-based medical research addressing if cannabis can inhibit the growth of new blood vessel formation to tumors, essentially cutting off the supply of oxygen and nutrients, which are both necessary for cancer to grow. Let's take a look. Current evidence suggests medical cannabis may inhibit chemotherapy-induced nausea and vomiting, stimulate appetite, reduce pain and inflammation, and decrease cancer cell proliferation and survival. In recent years, the medicinal properties of cannabis have received increased attention around the world. I'm referencing an article called Therapeutic and Supportive Effects of Cannabinoids in Patients with Brain Tumors by Drs. Rodriguez Almaraz and Nicholas Putowski. Studying and testing the role of cannabis as a potential adjuvant or supplement to cancer treatments is a particularly high priority if you ask me. There are three main components that are necessary for cancer to exist. 1. Cells must grow and divide, or proliferate. 2. They must avoid programmed cell death, or apoptosis. And 3. They need new blood vessels to form, called angiogenesis, to allow the delivery of oxygen and nutrients to the growing cancer cells. The most important of these components is number 3, but we'll very briefly touch on the first 2 points to be thorough. So, what are the anti-tumor effects of cannabinoids in brain tumors? Component 1, cell growth and proliferation control. Cannabinoids have been shown to inhibit cell growth in tumor cells via modulation of proteins and nuclear factors involved in the control of cell survival, transformation, and cell death. Component 2, pro-apoptosis. The activation of CB1 and CB2 receptors trigger different signal pathways that participate in cannabinoid-induced cell death in various tumor cells. The cellular signaling cascades for components 1 and 2 have been described with intricate detail, and I would be more than happy to describe these cellular cascades if you leave a comment requesting the detail. Now, for the final, and arguably the most important component necessary for cancer to exist, the growth of new blood vessels, angiogenesis. Angio, blood, genesis, new. Component number 3, anti-angiogenic effects of cannabis. It is well known that rapidly growing glioma cancer cell populations have high metabolic demands. Basically, they require high amounts of energy and nutrients. This increase in metabolic demand necessitates a new vasculature supply, making angiogenesis blockade one of the most important anti-tumoral strategies explored in recent years. As brain tumors progress, the vascular demand grows due to hypoxic or low oxygen conditions, thus triggering robust angiogenesis via the vascular endothelial growth factor and angiopoietin-2 pathways. Let's take a quick review of these pathways to better understand why cannabinoids are beneficial as anti-tumoral therapies. VEGF, secreted by tumors, is essentially telling the body to create more blood vessels to supply the tumor. Angiopoietin-2 essentially regulates endothelial permeability or loosens the interior structure of blood vessels. This figure will help illustrate the functions of both growth factors. Figure 1, here we see a tumor secreting VEGF. VEGF increases blood vessel expression and movement towards the tumor. Now the tumor has increased its blood supply. Figure 2. Here we see a before and after illustration of the blockade. On the left, vascular destabilization occurs when vascular endothelial growth factor, VEGF, and angiopoietin-2 levels are upregulated in the tumor microenvironment where vessels are functionally and structurally altered. These destabilized tumor vessels are characterized by pericyte loss, impaired endothelial junctions, increased vascular leakage, and poor vascular perfusion. On the right, vascular normalization occurs with the blockade of VEGF and/or Ang2, which stabilizes tumor vessels and induces increased vascular perfusion, which consequently improves drug delivery in cancer treatment. Cannabinoids have been shown to impair the VEGF pathway by blunting VEGF production and signaling, as well as VEGF receptor 2 blockade, the most prominent VEGF receptor in glioma cancer cells. While brain tumor therapies have improved the efficacy and safety profile over the last decade, these are not innocuous and have the potential of importantly impacting the quality of life of patients by inducing symptoms that include nausea, vomiting, liver damage, hematologic anomalies, pulmonary damage, cardiac disease, asthenia or generalized weakness, fatigue, mucosal damage, and neurological damage. Cannabinoids have shown a favorable safety profile in preclinical studies, as well as from pilot clinical trials in patients with recurrent brain tumors. In one randomized, double-blind, placebo-controlled trial, nabiximols, more or less an oral mucosal spray containing cannabis, was used to treat 27 patients with established glioma brain cancer and was conducted by 12 et al. And they showed that, in general, cannabinoids are well tolerated and that their safety profile is acceptable with few side effects. Additionally, this study showed a significant improvement of survival at 1 year for the nabiximols group, which was 88%, compared to the placebo group, 44%, with a p-value of less than 0.05, signaling that there is a benefit of cannabinoids in the treatment of glioma brain cancer. These results included clinical level data which showed that cannabis improves survival among treated patients. A 1-year survival rate of nearly double the placebo group. That's significant. Basically, you can be in group A and take no treatment, the placebo, and there's a 44% chance you'll still be living in 1 year from now. Or you can go in group B with cannabis and have an 88% chance that you'll still be living 1 year from now. Yes, we need higher powered studies, but these results are certainly promising. Additionally, cannabinoids have shown important potential, not only for counteracting side effects from standard therapy, such as chemoradiation, but they also have shown potential synergistic properties that position them as tumor treatment adjuvants or synergistic supplements. By promoting survival of healthy glial cells and neurons in different models of injury and suggesting additional potential neuroprotective effects of cannabinoids during radiation. Altogether, this evidence suggests that medical cannabis and cannabinoids could become a therapy of choice in modern neuro-oncology. However, further studies are needed to establish not only safe, but also efficacious doses. If you found this video to be helpful, please share it with others. Thank you so much for joining me. Again, my name is Dr. Thomas Henke. I hope you're having an amazing week. I love you. I'll see you next time. And until then, keep an open mind.